This episode touches on some sensitive themes related to violence, so please listen and watch with care.
True safety is about everyone being safe. Because the causes of violence are so complex, it literally needs everyone to play their role in it. So it's not seen as a policing issue, it's seen as everybody's issue. You zoom out and you have a look at how violence is affecting the local population before you zoom back in.
Hi, I'm Kieran Thapper and this is Safe, a conversation about violence affecting children and young people with adults who are trying to stop it. In policymaking, it's become trendy to talk about how we should try and prevent violence using a public health approach. But what does that mean in practice? Grace Strong is director of the Violence Reduction Network in Leicester, Leicestershire and Rutland. She has spent a career working with young adults who are entrenched in cycles of crime and violence. I'm here to talk to Grace about her journey from probation officer to community leader, why we need to treat violence as a public health issue, and why Focused Deterrence, a groundbreaking new approach, is such an effective way of working with young people. Grace Strong, welcome to Safe.
Thank you.
Thanks for being here. When you were a child, what did being safe mean to you?
I think for me, it was largely about belonging and thinking that I mattered to other people. It was also about knowing and having the confidence that no matter what, so if something went wrong, if I made a mistake, adults might have something to say about it, but they would be there for me and they would make sure that I was okay. Things that made me feel unsafe was when things got chaotic, and when other people around me weren't safe. That used to really unnerve and upset me when I was younger. And I think that's something that we often miss, is that actually true safety is about everyone being safe. And I think that's particularly the case when we're talking about young people.
What events in your childhood or your youth do you think inspired you to do the work that you ended up doing, which we're going to talk about?
Yeah, it's quite hard for me to make sense of how I've ended up where I am. What I do really remember is that my home was really safe. My mum and dad didn't have that safety when they were young. They were really determined to make sure that me and my sisters were okay and that we had a warm and safe home. But at school, for example, it was a lot more chaotic. There's a lot more going on there. I was really aware that a lot of my friends weren't very safe. There was lots going on for them at home. That was playing out like it does within the school environment. And certainly my school, particularly when I was young, I don't think they coped with it very well. So there was a lot of punishment, a lot of isolating my peers, etc. And it just made the whole experience just very tricky and difficult. And I remember picking up on that contrast, that I enjoyed that home life where things were okay, but a lot of my friends didn't.
How did your career kick off then?
I've spent the majority of my career in the probation service. It wasn't like a sudden decision or anything like that. I knew that I wanted to work in an arena where I was supporting other people. I'd noticed that there was a lot of inequality in life and social injustice, and I felt quite passionate that I needed to do something about it, and I needed to put my energy into something that would result in positive change. But for years, I didn't really know what that was. I did all sorts of voluntary work. And then whilst I was studying, I came across the criminal justice system, got really fascinated with it. But as I was kind of looking more and more into it, it just seemed like an awful lot of the system was about processing people. And then I came across probation, which was so much more about forward-looking, working with people, actually bringing about change and actually problem-solving things rather than just processing people through the system. So it just interested me. I got a bit of work experience, got a job for a year within the probation service, and then decided that was it. I was going to go for my qualification, and the rest is history, really.
What is probation?
Probation, it's a really old organisation. It's changed hugely over the years, but its origins were, the phrase was advise, assist and befriend. So it was about supporting people in contact with the criminal justice system to address whatever issues are underpinning the reason why they're in contact with the criminal justice system and try and support them so that they could make positive change. It's really changed over the years. So at various times, it's lent more towards an enforcement culture future. But certainly in the years that I was in the probation service, it was largely about rehabilitation and supporting people to move away from offending.
Okay. And was there something in that those early years when you were a probation officer and working in probation that really shaped you? I'm just interested to sort of bring it to life for people. Is there a sort of memory or relationship that you form that you think of when you think of that early time?
Absolutely. So I started my career once I'd qualified in a team that was working with young people. So back then, probation worked with 16 and 17-year-olds, and I had a caseload of mainly boys and young men between the ages of 16 and 21. Some of them were in the community, but a lot of them were in the local young offender institution. So I spent a lot of my time going backwards and forwards between the local community and within the YOI, seeing them and getting to know them. And what really struck me back then was just how similar all of their stories were. Not all of them, but the majority of them would talk about their childhoods, what experiences they had within them. There was stories of trauma, there was stories of rejection and isolation, and it just really struck me how complex that was. And how preventable it was. There was lots of missed opportunities in their childhood, and yet now they were in this situation where they were expected to change and change quickly, but things had become very, very difficult. And I remember really struggling with that. It just felt so, at times, so tricky, but there was always that kind of hope that things could be different. And one of my earliest memories was with one of those young boys who was in a desperate state, had all sorts of trauma in his background, and really didn't believe for a minute that things could be different for him. And I tried so hard to support him, but he just kept taking one step forward and two steps back, got very distressed at times about things. But I just kept saying to him that I believed that he could do it and it would all be fine. And he kept going backwards and forwards in and out of prison for as long as I was working with him. And it was years and years later. I mean, I was on maternity leave, so it'd been probably 5 or 6 years later. I was in Leicester with my eldest child in his pushchair, and all of a sudden I heard someone shout my name near Leicester Market, and kind of was a bit taken aback by it, and looked up and saw this man coming towards me, and obviously thought, what's this about? Because I didn't recognise him. And as he came closer, I realised it was him. And he came up to me and he couldn't wait to tell me how things had changed for him. So things like he'd stopped taking drugs, he'd found himself a flat, he was working, he was back in contact with his sister, which was really important to him. And the reason I didn't recognise him at first, because he was just so animated and so happy with life, which was fantastic to see. But then the timing of it was perfect for me as well, because I was a young mum. I was doing the usual kind of struggling, getting used to motherhood, etc. And the last thing he said to me when we finished the conversation was, "I bet you make a great mum, don't you, Grace?" And for me, it was that kind of human connection that really motivated me to stay in probation, even though it was pretty tricky back then.
Yeah, and I guess that story really roots a lot of what this conversation is about, the idea that violence happens for lots of complex reasons, and therefore the way of solving it as well takes a lot of complexity, which I think your career since that time has proven. Over the years, especially over the last 15 years, 10 years, it's kind of become accepted wisdom that we should treat violence as a public health issue. What does that mean?
Well, for me, it's the opposite of the dominant way of us looking at violence. So violence is usually seen as a criminal justice issue, and an awful lot of the resource goes to reacting to it or responding to it. So it's after the event. Often the focus is very much on the individual and the need for that individual to change. It's quite reactionary, and it's very expensive as well. To me, a public health approach is very much about seeing violence through a health lens and recognising, as you've said, that it is really complex. It has root causes, but optimistically, those root causes can be addressed. And through addressing those, you can actually prevent violence. So it's a real kind of message of hope. It's a very inclusive approach because the causes of violence are so complex, it literally needs everyone to play their role in it. So it's not seen as a policing issue, it's seen as everybody's issue. And whether you're a parent, a professional, a citizen of this country, you have a role to play in preventing it. The other different things about a public health approach is it really uses data and insights to really understand the problem. So we have a tendency to jump to the solution really quickly, whereas a public health approach, I always refer to it as like you zoom out and you have a look at how violence is affecting the local population before you zoom back in. So using data and insights to really understand the where, the what, the when, the how of violence. And then that allows you to come up with those solutions, preferably evidence-based solutions, to actually tackle it. So it's very much prevention focus, all about collaboration, and really importantly, it's about a long-term approach rather than that kind of reactionary short-term approach that the criminal justice system often takes.
My experience in this violence prevention world is one where I've mostly been in a world where the public health approach is becoming the norm. So I've been able to make that argument whilst it sort of gained steam.
Yeah.
It always therefore surprises me that this wasn't kind of common knowledge. I just wondered your take on why do you think that it's taken so long for people to figure out this kind of approach? What was going wrong before?
There is something about the way that we work that tries to oversimplify things and is interested in immediate gratification. So we want solutions right now. And you can kind of understand it with an issue like violence because it's happening right now and people are getting hurt. So I do understand why people jump really quickly to actually responding to it. I think we have a very punitive system as well. So I think the focus is often on the individual and needing to punish them for what they've done wrong rather than looking at the reasons for why the event might have happened in the first place. So I think part of it is that the public health approach requires us really to slow down a little bit. And that's really tricky when it comes to something like violence, where there is that real sense that you need to do something straight away.
How did you learn some of that wisdom about public health and slowing down as you sort of progressed through the ranks, so to speak?
Yeah.
How, what were some of the key lessons that you took from that allowed you to then take on this role that you've got now, where you're really bringing the public health approach to life? What did you learn through that journey?
I think without a doubt, spending years and years in the criminal justice system, working when something awful had happened, working with people where lives had been devastated through violence and through different other types of crime. I think I learned an awful lot through that. I could see the patterns behind offending, and there was always common themes, and a lot of the things that had happened to people before they'd become in contact with the criminal justice system, they were preventable. They were things that could have been different. A lot of particularly the boys and the men that I worked with, I recognised them. Even though I didn't know them, they were really similar to the boys that I went to school with who were getting into trouble all the time. And I could see that there was a way of preventing it, but the system had failed them and failed us as a society as well because it hadn't intervened at the right point. So I guess I kind of already had a really good understanding of what leads to violence. So I had a real appetite, if you like, to try and do more to prevent it from happening in the first place. But throughout my career, I've also tried to always work in partnership, knowing that there's no way me as a probation officer can possibly solve all of those issues. So I've really learned that collaboration is the only way to solve something as complex as violence, because you literally need the whole system cooperating and co-owning the problem. So I think for me, when I came across the public health approach and read about it for the first time, it just made complete sense to me, even though I didn't know what it was when I first heard about it.
It makes sense, therefore, that in the late 2010s, when there was this rollout of violence reduction units and violence reduction networks across the UK, that you were obviously interested in trying to play your hand in shaping them and bringing that to life in your local area. That was obviously following the violence reduction unit that was set up in Glasgow in the 2000s that had a huge amount of success in reducing violence affecting children in that city. You helped to establish the violence reduction network in Leicestershire and Rutland, and you're still working there now, which is a really impressive longevity, I think, in a sector that often sees a lot of cycles. It's great that you've kept that leadership position. Just talk me through that shift of taking on that role and what you think the Violence Reduction Network has been able to achieve.
In terms of setting up the first violence reduction unit in Leicester, Leicestershire and Rutland, one of the first things I did, in fact, it was one of the decisions that I made on my own, was not to call it a unit. So decided I was going to call it a violence reduction network, and that was obviously really intentional. It felt to me that unit sounded far too solitary. It also put the weight of the world on my shoulders, because I was thinking, how am I possibly going to, prevent and reduce violence in the area on my own, or even with just a small team? So we set it up as a network straight away, and it was a really great decision that we made, because it set the tone, and it was inclusive, and it was about everybody having a role within it, and that kind of joint ownership of the problem locally. So that was a really important move. But also, I know through previous experience that you have to find the people that are going to support the cause, and quite quickly. I was really lucky in Leicester. There was a number of different chief execs and directors of children's services who really had the appetite to do something different and to really see how that public health approach could make a difference to our communities. So I kind of built that alliance of the willing very quickly as well. And I got out and about a lot. So I spent a lot of time in my local communities, just talking to people about violence, how it affected them, what their experiences of it were, and what they thought that the Violence Reduction Network really needed to concentrate on. So I just got started, really. It's been really hard work, because a public health approach is a real discipline. It's about thinking and behaving in a certain way all the time. One of the very important things we did early on was to bake that into what we were doing. So we agreed a mission with everybody, which was keeping young people safe, nice and straightforward. But we also agreed some core operating principles as well. So we committed to always being data-led, always using the evidence base, working with communities as partners, which was really vital to us locally, and I believe nationally as well, and that we'd always evaluate and understand our impact.
When you just said working with communities as partnership, and you've kind of spoken to that a few times in this conversation already, can you just bring that to life? Can you give an example of where does a community member become a partner in this kind of work?
Violence happens in communities, that's where it happens. And so it makes perfect sense that communities are involved in making sure that we understand the problem thoroughly, but also in generating the solutions. We've involved communities in various different ways within the Violence Reduction Network. So if I give an example of designing a new intervention, we will make sure that we co-design it with the people most affected by violence and who we would hope would benefit from that intervention. So they're involved in the co-design from the beginning. If we're recruiting staff to a team, we'll involve them in the recruitment of those staff. So, for example, if those practitioners are going to work with young people, we want young people to be involved in the interviews. We often involve communities in the actual delivery of different interventions. So we have a team of community navigators working in one of our Focused Deterrence intervention, the Phoenix programme, which brings huge value and strength. Involve communities in training, in learning and development, like training other professionals. And then really importantly, communities sit on our board and they also participate in our community oversight group as well. So for me, it's not difficult at all. For some reason, different organisations resist it or aren't confident doing it. But actually, it's something that just strengthens the overall approach to violence prevention. So it just makes sense.
If you're enjoying this conversation, hit subscribe or follow to make sure you don't miss out on the next one. And feel free to leave a comment or a review. I came up to visit last year to Leicester to see one of your programs, the REACH program.
Yes. Yeah.
I just wondered if you could, I found it really interesting. I thought it was also good to see something truly preventative that was connected to local schools. I just wondered whether you could talk to that a bit and explain what it is.
Yeah, sure. So the REACH programme is one of our many interventions that operate in Leicester City and the county as well. And it basically involves youth workers connecting with young people within the school environment. Those young people are at risk of suspension and exclusion. They've already experienced that. And we're worried about them because there's other indicators that they'll get involved in crime and violence if we don't put the support in at that early stage. So it requires really close working and collaboration between the education sector and the youth work sector. And really focuses in on supporting that young person in whatever way that they need so that they can stay in school, because we know that's the best thing for the vast majority of children and young people. And it just works really well. You know, we haven't had the evaluation back, but the teachers, the young people tell us the difference it's made. You know, suspensions and exclusions have reduced. Those young people are still in school, and there is a really low rate of them getting involved in violence from our local monitoring. So it's just a brilliant example of how if you collaborate and join the dots and put the support in for children in that kind of reachable space, then actually you can get results.
I suppose now that you've got a role working in Leicestershire Police as well, your ability to see both that type of program where you're seeing schools and youth work, but also now understand, well, how long having understood, but especially now understanding the policing side of it as well. How do you kind of balance those roles and understanding the problem and solving it?
With policing, obviously that's very much a criminal justice agency. Schools very much aren't. But going back to the public health approach, if we want to tackle violence, if we want to prevent it in the long term, we have to have really high levels of connectivity and collaboration between all the different parts of the system. I always say that if we're not achieving that as adults, we're letting young people down. So we have to find ways of kind of marrying up different cultures and working together under a common purpose. So if we want to keep young people safe, then we have to make sure that those things are put to one side and we as adults find ways of working together. But invariably, there's always a rub. It's a complex issue. You know, often we're talking about harm being caused to young people and communities. So we do have to find that balance between the more supportive side, which is absolutely everybody's preference and priority. But if needs be, we do need criminal justice responses as well. And we've certainly found locally that we are able to balance those. It can be a bit bumpy at times, but we are able to balance them. And then it's just a much more cohesive, joined up approach that kind of works for everybody.
That brings us on to Focused Deterrence, which you've already briefly referred to. So one of your sort of flagship violence prevention programs, obviously the Youth Endowment Fund, we're funding and evaluating it. The Phoenix program, which takes a focused deterrence intervention style. This is currently in this country considered as like a kind of groundbreaking new program style. And that can really transform how communities work together to prevent violence, as you just explained. The Youth Endowment Fund Toolkit, based on research from America thus far, obviously the work you're doing and others in this country is the first time we brought it to the UK, right? Which is what makes it so interesting. Shows that it has a high impact on preventing children becoming involved in violence. What is it?
Yeah, so it's a really interesting programme, and for us locally, it has very much filled a gap that we've had. So it focuses on those people that are involved in serious violence, so committing it, where there's a group dynamic. So basically, there's lots of connections between individuals, and those connections are driving a lot of the behaviour. Factors like substance misuse are as well. So it's kind of groups of offenders committing violence, young people and adults, I would add. But often what happens is that's dealt with in quite a disparate way. So on one side, support agencies will be trying to support those individuals to move away from the violence. And on the other side, criminal justice agencies, policing will be enforcing, and monitoring those individuals, etc. Focused deterrence, in my mind, brings it all together so that it's that kind of more joined up programme. So it has three main elements. It has the support element, which is very much about making sure that there's very concrete offers of support to those individuals. That support is offered in a really explicit way. We'll say, we're worried about you, we want to support you, this is what the support offer is. However, if they decline that support offer or continue to be involved in violence, we can't leave that as it is, because people are getting harmed or will get harmed. And so then comes in enforcement. So that follows up quite closely behind. And we're really explicit with that individual about that's what will happen. So there's very clear messaging about it. The third element, which I always think is the missing element in a lot of different criminal justice-based interventions, is the community element. So communities are part of that partnership. They're involved in the messaging in terms of violence hasn't got a place here, it's not acceptable, we're worried about you, we want to support you. But they're also involved in offering some of that support as well, because we know that the best way of people desisting from violence is that they feel connected to their local communities, they have opportunities in their local communities. So Focused Deterrence just has this way of bringing all those three components together, which from the point of view of the participants just means that it's a much smoother journey and much clearer than what often happens, which it's very disparate and they don't know whether they're coming or going.
I suppose when we talked about the REACH program, you can think about that as being much more upstream, right?
Yeah.
That's the sort of phraseology used. And then Focused Deterrence is more downstream, where someone, a young person, they're probably usually older, are becoming more entrenched in webs of problems and social relations that lead them to violence. Our latest data, Youth Endowment Fund's latest data, showed that only 39% of children who physically injured someone in the last year said that they were offered support to stop it from happening again, which I think speaks to part of the problem here, which is that often that support is not finding young people quick enough before they then descend into these cycles. Going back to that first part of Focused Deterrence that you just spoke about, that offer of support, can you give some examples of what that might look like, and the community navigator role who might deliver that support or deliver the messaging of it, who might they be?
Yeah. So the offer of support has to be relevant, responsive, useful to that young person. So the starting point, I guess, is to make sure it's co-designed with young people so that it is going to hit the mark, basically. What we've learned over the years, and certainly throughout my career, that there isn't a one-size-fits-all. And so the offer has to be really tailored to that individual and whatever they need. We need to try and make sure it happens if that addresses their particular issues. In the Phoenix programme, for example, we often talk about hope, opportunity and connection as being three really important elements of that support. So we need to have we need to be giving that message of hope that things can be different. That's often where the community navigators come in, because they have lived experience. So they've been there, they've walked in those shoes, and they're able to kind of show that things can be different. But then there also has to be opportunities, those opportunities to work on yourself, whatever that might look like, but also those opportunities that help you to move on with your life in terms of things like employment, housing, substance misuse treatment, those kind of things, whatever's needed. And then critically, it's also about connection and belonging and feeling as though you matter. And that's about making sure that individuals have either those family and or those community connections, those relationships, so that when that offer of support comes to an end, there's still support in place. So that kind of sustainability and that legacy. So for me, it has to be a really comprehensive package that's very much tailored around the individual. And we have to try and avoid coming up with packages that we think are okay, but actually don't even touch the edges from the young person's point of view.
You've been running Focused Deterrence for a number of years now, and I guess you're still learning, it's still early doors of how you do that really effectively. What have been some of the really big challenges about it, and how have you overcome them, or how are you trying to overcome them?
Yeah, so I think one of the biggest challenges is because Focused Deterrence brings together those three elements, in a way, that's the challenge, because they can compete with each other and they can conflict with each other. That's more reason to bring them together. But without a doubt, it can be really bumpy and really tricky. There can be different perspectives amongst professionals. There has to be a lot of thrashing out behind the scenes. What our combined approach is, how we're going to work together effectively. So a lot of the challenges are about bringing those different partner agencies together with those different cultures and ways of working. Other challenges are we have a real tendency to want quick wins and to see progress really quickly. But we're talking about individuals who have had very kind of complex backgrounds with all sorts of things going on. And we need to be a bit patient with progress. We have to make sure we're protecting the community. We have to make sure that we're not allowing harm to happen. But we also have to just recognise that actually progress might not be as quick as we'd want it to be. But it is progress and it's moving in the right direction. So there are a couple of the key challenges with the programme. Other things are to do with like the cultural change of the programme. So at first there was a few raised eyebrows about bringing in community navigators with lived experience. We've been able to show that the world doesn't come to an end, and actually it's absolutely possible for people like the community navigators to work alongside police, probation, youth justice. It works really well. And then
they're often based in the same building, right?
They are, yeah, they're co-located. It was really important to us. We didn't want distance between the community navigators and the other professionals within the team. We wanted them all based together. That was really crucial in terms of the effectiveness of the programme. And without a doubt, it's what makes the programme different is the fact that there's people working in it who have had that lived experience themselves.
We obviously take seriously at the Youth Endowment Fund evaluating and testing these programmes. I just wondered, it's obviously challenging also to do that. You're trying to make sure that these programmes are reaching the right people and having a high effect, and you're trying to put your energy into that. Mm-hmm. But we're also trying to make sure that what you're doing is working, is effective, that you're collecting all the data you need to make sure you can do it bigger and better next time. Mm-hmm. I just wondered if you could talk through some of the value of doing that, admittedly with some of the challenges as well.
I mean, it's been quite a journey for me. Whilst I was working probation, I did have some experience of evidence-based practice. All of the accredited programmes in probation are evidence-based, and there's really high programme fidelity. But what really struck me when I came into the violence reduction unit and started to work with experts in research and evaluation was just how often the system would design programmes not particularly using the evidence base and wouldn't build in monitoring and evaluation from the start, but would be happily delivering them, in whichever way they wished.
Often in very costly ways.
In really costly ways, and with no real kind of confidence that they would work. And so for me, as I say, it's been a journey, but why wouldn't we want to design interventions using the evidence? Because we want the very best for our young people. And also, why wouldn't we want to contribute to the evidence base by monitoring and evaluating and continuously improving? It's unlikely we're all going to get everything right straight away. But if we have our best bet and we kind of build in that kind of understanding as to whether or not we're having an impact, and if we are, how are we? How do we know? Then actually we're kind of wasting opportunities, really. But without a doubt, there's challenges to it because it does take up resource, of course it does, but also there's a real discipline to it as well. And it's often seen as a nice to have, particularly when resources are really stretched. Whereas from my point of view, what we've shown in Leicestershire is it's absolutely essential, and it's a way that we improve services for young people.
How do you think that Focused Deterrence, assuming that it continues to grow as a principle and develop, how do you think it could change practice across England and Wales? Obviously, it's being delivered in multiple cities, and that's great. It would be great if it continued to grow. And I wondered how, like, sort of systematically, it could alter how things are done in communities. Do you see a vision for that?
I do. I think for me, the real kind of hidden benefit to it, or it was hidden originally, is around community involvement. I think for far too long, communities haven't been let into service delivery. They haven't been trusted to do that. And as a result, we haven't been able to use that strength. When you look at lived experience and communities that are most affected by violence, there is incredible knowledge and strength within that. As I said earlier, violence happens in communities. So we have to make sure that there are empowered and enabled to be part of the solution. Focused Deterrence has such an explicit part of it that is about community involvement. And I think it's that really sets it apart from other perpetrator programmes. So in terms of that vision, I think locally we've proven that having community navigators within our particular programme is really valuable. And actually it's something that we need to see a lot more of going forward.
Can you talk me through an example of a person, a group of people, a community, a community navigator? An example where sort of you've seen it go from beginning to end, because obviously it's easy for us to have this sort of policy conversation, but that sort of human journey, can you think, obviously without revealing any sort of crazy details, but just I'm interested to see that journey play out.
Yeah. So I guess the journey with the community navigators, and this is kind of secondhand because I'm not a practitioner anymore, I'm not actually working within the team, but what they have found is that by being that kind of credible messenger at the beginning, so when we're first making that offer of support to a potential participant, that they're able to deliver that message in a way that is far more kind of credible and authentic than somebody that hasn't been in those circumstances. So straight away, they're kind of like ahead of the game, and they're more likely to get engagement because apart from anything else, the potential participant on the other side is kind of quite taken aback, probably quite used to having police and probation, contacting them, often because they have to be in contact with them. But actually, when somebody like a community navigator makes contact, I think it probably feels different, and it is different. So I think that starting point is so crucial. But then in terms of someone being able to kind of walk alongside that participant throughout the journey, so recognising that there will be lapses and relapses, that there's often a step forward, 2 steps back, etc. Those navigators will make sure that they stand next to them all of the way. So that bringing hope, recognising that things can be different, but also hand-holding, supporting them so that they are able to access services, etc. That's the kind of feedback that we get from participants who have been successful in the programme, is actually it was a community navigator, that realisation that things could be different and someone being prepared to be right next to them through that journey is what had the impact.
It's really inspiring to see a principle that I feel like I often come into contact with when thinking about American styles of violence prevention, where you have that violence interrupter idea, and it's really refreshing to hear it being sort of spreading in the UK and to have that idea being born out in communities, because I think there is so much untapped potential in young people, adults who have been there themselves and done it themselves, and often that can be a reforming process that they go through themselves, right, if they receive the training, and that's so it just has this massive knock-on effect that could be really transformative.
Yeah, absolutely. Absolutely does. It's almost therapeutic for them. There's an element of redemption about it for them too.
Right.
But in terms of, as you say, it's that kind of mutually beneficial relationship. But I'd also say that it has a knock-on impact across the other professionals within the team as well. So they get to see the strength of that, and maybe they have their views changed about people that have been through the criminal justice system themselves and the value that they bring, that, actually it's not about them and us, it's about all of us working together, and that's where we start to see change and start to see success.
What do you think is particular about the part of the country that you work in, especially right now, I suppose? Is there something to say about some of the challenges that you feel like you're facing regionally? Often we're sat in London right now, and often I'm having these conversations with Londoners or thinking about London, and the rest of the country often gets neglected in that. And I'm just really interested in hearing some of the nuance there.
My home area, Leicester and Leicestershire, is full to the brim of strength, basically. It's a very vibrant area with an awful lot to offer, often in the shadows of the bigger cities, etc. It's also got its challenges as well. A lot of our young people report not feeling very safe at the moment. That's often as a result of kind of like global things that are going on or things going on in other countries. I think that because of things like social media, it just brings it right into their world locally. So sometimes they're feeling unsafe because something that's happening on their doorstep, but sometimes it's something that's absolutely miles away as well. So through the Violence Reduction Network, we do all sorts of work with young people to kind of make sure we shine a light on what's positive, as well as address those issues that are causing them concern as well.
On that note, working with young people locally, I'm really glad that the Leicestershire VRN is going to be taking on the Peer Action Collective for the next round, which is a youth-led research program that the Youth Endowment Fund collaborate with teams across the country to try and bring to life. So I'm really glad that that's happening. Can you just talk me through what that's going to look like? Obviously, we're just getting started now.
Yeah, of course. We're incredibly excited about the PAC project and absolutely delighted to be part of the partnership. So for us locally, we were already doing lots of work around youth involvement, but when this opportunity came up, it was just so obvious that we needed to go for it because it will bring peer research into our area. We are focusing on the topic of policing, so it also means that those young people will be able to research an area that really matters to them. We're very excited because our chief officer team in the police are very committed to the project. They're really looking forward to how it develops, looking forward to the recommendations, etc. We're going to make sure that we link in regionally and nationally as well, so that those young people have a chance to really affect change nationally as well as locally for us in Leicester too. So yeah, really exciting project.
Why do you think it's important to have young people holding police to account like that?
I think it's absolutely crucial that young people are involved in not just holding the police to account, but making sure that they're sharing their perspectives and they're kind of making sure that police and other agencies are incorporating their views, their perspectives, their solutions, their experiences into policy and practice. In order to deliver anything for children and young people, we need to be involving children and young people because we can't possibly know what life is like for them at the moment. So we need to make sure that they have that platform and are empowered really to let us know. And then obviously it's up to us as adults to make sure that we act on that and make the necessary changes.
And finally, if you could go back, yourself now and go back to speak to maybe that person that stepped into probation to work there in the first place and give them some advice, what would you say?
I think I would start with saying that violence and crime is preventable. I think that's what I would say. I think working in the criminal justice system, sometimes it feels like it's inevitable and it's just going to keep happening. And actually my experience now has really shown that it's completely preventable if the right support and intervention is put in at the right time and in the right way as well. I think I'd also say accept the complexity. It is really tricky. But you need to work within that complexity and you need to not oversimplify things or almost beware of simple solutions because actually the solutions can't be simple because the issues are so complex. And then I'd also say look around you for where you can collaborate because actually you can't solve it on your own and there's a whole host of resources and other great people that can kind of play a role in the work that you're doing. And then finally, I'd definitely say be courageous. If we carry on doing the same things, then we're going to get the same results. And actually, with that preventative approach, you've really got to hold your nerve and you've got to do those things that really matter and that you really believe will have an impact.
Grace Strong, thank you for coming on Safe.
Thank you.
If you'd like to find out more about how to keep young people safe from violence, hit the link in the description.